is at the top and contains the hard palate and the soft palate. We have the oropharynx, which is in the middle and contains the base of the tongue, the tonsils, and the valvula. So the naso, you can imagine, is pretty close to your nasal cavity. The oro would be oral. Then the laryngopharynx is at the very bottom, near the larynx. All right, epiglottis is a small leaf-like flap of tissue at the bottom of the laryngopharynx. This flap closes when a person is swallowing to prevent food or liquid from entering the air passages. So if you've ever taken a drink of water and you're like, oh my gosh, it went down the wrong hole, and you can like feel it, that's because the epiglottis wasn't working properly. It's nothing wrong with it. It's just a fact of nature. Nothing can be 100% all the time, right? Okay, so larynx is below the epiglottis. It contains the vocal cords, which produce your audio, you're singing, you're talking, you're yelling, whatever. The thyroid cartilage, which is more commonly known as the Adam's apple, so you can feel it, it kind of sticks out a little bit. The cricoid cartilage is the only completely circular ring of cartilage in the upper airway, so that's pretty interesting. The trachea. All right, so the trachea is the passageway for air into the lungs. The trachea marks the beginning of the lower airway. It extends from the cricoid cartilage to the carina, which is where it splits into two passages. The front of the trachea is composed of rigid C-shaped cartilage rings, which provide it a lot of support. The back of the trachea is made of smooth muscle, which if you just reviewed your cardiovascular system, you should know what smooth muscle is. If not, you need to get those notes out and look at it. Okay, the bronchi and the alveoli. So the trachea has branches into two tubes called bronchi. These are referred to as the right main stem bronchus and the left mainstream bronchus. The main stem bronchus is shorter, wider, and more vertical than the left. The bronchi enter the lungs, and then branch into smaller and smaller bronchial tubes called bronchioles. The bronchioles have small air sacs at the end of the alveoli. Each alveolus is surrounded by a web that allow oxygen and carbon dioxide to be exchanged. And then remember, the alveoli are just like those small little air sacs. So they're helping with the exchange of oxygen and carbon dioxide. All right, the lungs. Key organs of the respiratory system. They contain alveoli, two lungs separated by a mediastinum, so you can see on this picture. The lobes. We have the superior, the middle, and the inferior lobes. Again, you can see and you can imagine superior going to be high, middle in the middle, inferior are low. Then the pleura are a thin, slippery, double membrane surrounding each lung. Each lung is surrounded by that pleura, and the space between the two layers contains a pleural fluid that is lubricating that spongy, delicate lung tissue to make sure that it's not getting worn out, it's not, being injured in any way. It protects against friction that would be produced with the movement of breathing. So that little liquid is really helping your lungs be able to live out with you lifelong. All right, so the muscles for breathing, I briefly mentioned the diaphragm earlier, so just to get a little information, the diaphragm is a flat, dome-shaped muscle below the lungs. It separates the thoracic cavity from the abdominal cavity. The intercostal muscles are between the ribs, which we should already know from the muscular system. When a person inhales, the diaphragm and the intercostal muscles contract, which we talked about. And then whenever they exhale, all of those muscles are relaxing. All right, so we're going to go over a quick few diseases. So first, we have lung cancer. It's the leading cause of cancer death in both males and females. The main cause would be exposure to carcinogen, which cigarette smoke, things of that nature. We know that smoking causes lung cancer, vaping, things like that. Experts are telling us we shouldn't be doing because it causes lung cancer. So the prevention, making sure you're not around people that are smoking, you're not smoking yourself. Prevention is really, really the key because there are no symptoms in the early stages of the disease. So once you know you have it, it's probably pretty bad. Treatment can include surgical removal of the lung or sections of the lung, as well as chemotherapy and radiation. Atelectasis is the collapse of part or all of the lung. It may be caused by blockage of the air passages or by injury. Symptoms include severe pain and shortness of breath, and then treatment involves correcting the cause of the collapse and using pulmonary suction to re-inflate the lung. So basically, the pulmonary suction is making it so that the lung can expand again. Chronic obstructive pulmonary disease is a term for any disease that causes recurring blockage of the air passages. It actually refers to a group of chronic conditions. So examples could be chronic bronchitis, emphysema, which is smoking is the main cause of COPD, but allergies and persistent infections are also possible causes. So if you are getting sick over and over and over again and you can't really fight it, that could be a cause for COPD. So you definitely need to make sure that you are getting medical attention and you're expressing all of these concerns to a doctor if you do have a chronic illness like that. All right, asthma is pretty common. It's a condition where the bronchial tubes are inflamed and as a result obstructed. An asthma attack can be caused by allergy, infection, or anxiety. Symptoms include sudden tightness of the chest and difficulty breathing along with wheezing and coughing. Sometimes, especially in younger children, they'll have activity-induced asthma. So if they start running a lot, they'll have an asthma attack. So they kind of refrain from sports and things of that nature. Most of the time, an inhaler is the biggest treatment. It can't necessarily be fixed long term, but the inhaler helps untighten that chest and strengthen that airway so that you can begin breathing again. So you would want to, if you had asthma, you'd want to carry around your inhaler all the time. Pneumonia is the inflammation and infection of the lungs. It is infectious, and often it affects people who are bedridden, elderly, or frail. So if you think of the population of people that it often affects, you can also probably note that that population probably can't fight off such an infection. It's caused by a bacteria, virus, or chemical. Too much moisture builds up in the lungs and impairs breathing. In addition to difficulty breathing, symptoms include chest pain, fever, and chills. Treatment may include bed rest, antibiotics, and oxygen therapy. If it's caused by a virus, though, antibiotics won't help. So viral pneumonia is a little bit more worrisome. All right, tuberculosis. The bacteria that causes tuberculosis are spread from one person to another through tiny droplets released into the air via coughs and sneezes. Tuberculosis is highly infectious. You will have to be tested for TB if you go into the medical field. So a lot of strains of TB resist the drugs most used to treat the disease. People with active TB must take several types of medication for many months to eradicate the infection and prevent development of antibiotic resistance. Antibiotic resistance is when you take antibiotics, but your body does not take them well. The antibiotics are no longer killing that bacteria that is infectious. All right, so quickly, lung function tests known as PFTs are used to diagnose various diseases and disorders of the respiratory system. Spirometry is one of the most common tests that is used, and it measures how much air a patient can inhale and exhale. So that could tell you the strength of your lungs. Diseases, peak expiratory flow, or PEF, is also called PEFR, to incorporate the rate that someone's breathing, is the person's maximum speed of expiration. So that would be that inhalation, exhalation, all coming full circle to talk about the rate. If you guys have any questions, please reach out to me. Ask me. I'm here to help. Email me anytime. I haven't gotten many questions, especially from this packet. So please let me know if you have any, and I hope you are all doing well.